Gang of bad bitches sitting on my standby. In on my stand, bitches sitting on my standby. In on my stand, bitches sitting on my stand. Gang of bad, gang of bad, in on my standby.
Integumentary system is a group of organs that constitute the body exterior, covering and defend it against a variety of hazards such as infection, dissection, abrasion, chemical attack and radiation damage. Do you guys know that our integumentary system comprises the skin, which is a thickened keratinized epithelium composed of many layers of cell and is mostly impermeable to water. It also contains immune cell and specialized cell that release melanin to protect the body from the cancerous effect of UV radiation. Our integumentary system majorly acts as our physical protection that offers first-line protection by preventing direct entry of pathogen. Our body undergoes the wound healing process through this system. Not just that, our skin could synthesize vitamin D just from exposure of sunlight. Our skin regulates body temperature by controlling the amount of heat released to the surrounding and having sensory nerve endings that can discriminate pain, temperature and vibration. Me, Alif, as a dermatologist, have some experience that I would like to share about nail fungus because I have treated a lot of these cases. But before we are going deeper, let us know about the organ that make up the system and each of their function.
Thank you so much for inviting me today. Hi, I'm Alia, the founder of Alia Beauty Forever Cosmetic. When I was in high school, my friend always complained, Alia, I'm so stressed with my skin. I spent $1,000 in finding the best product for my skin, but it doesn't work. Since then, I started to explore more about human skin and I met few skin specialists, including the person besides me. I'm sure some of you know our famous dermatologist here, Dr. Sabrina.
It's a big pleasure to be here today on this huge stage to talk in front of many people today. Just look at our skin. It may be underestimated by the majority, but they are actually very complex and secure. It is composed of stratified squamous epithelial cells that further break down into 4 to 5 layers. The epidermis regenerates from stem cells located in the basal layer that grow up toward the corneum and devoid of blood supply and derive its nutrition from the underlying dermis.
Yes, that's correct. Each of our organs have their own functions that gives many positive benefits to us. Let's start with the first one that we can see physically with our eye, which is skin. Our first layer is called as epidermis, which can protect our body from invasion of pathogens such as bacteria or viruses and also UV light. Our skin stays hydrated and healthy as the epidermis can hold in the water. The epidermis has cells called melanocytes which produce melanin that provide color to our skin. This epidermis is always supported by the second layer, which call it as dermis.
Wait, I think you forgot the last layer, which is hypodermis. Hypodermis is the underlying connective tissue and contains 2 layers, which are the superficial papillary dermis and the deep reticular layer. It is commonly referred to as subcutaneous tissue and is composed of loose areolar tissue and adipose tissue. But the dermis as a whole contains blood, lip vessel, nerves, sweat gland, hair follicles and various other structures embedded within the connective tissue.
So, do you know what's the function of hypodermis? This layer provides additional cushion through its fat storage called adipocytes that can act as shock absorber. It can protect your body as it allows your skin to move smoothly over the tissues and muscles underneath it so that your skin won't rub against tissues and muscles. What else, Dr. Sabrina?
Next, organ that make up this system is the thing that we love to caress, which is our hair. Hair growth has multiple phases called anagen, catagen, and telogen that cycles depending on hormones and nutrients. Hair covers the majority of the body with the only few exceptions like our palm. Erector pili muscle located in the dermis attached to hair follicle, helping the shaft to stand and trap air close to the epidermis for temperature control. But Mrs. Alia might want to tell more about its function?
Yeah, sure. Hair serve as mechanical protection for the skin, serve as a sense organ. You know, sometimes when you feel cool or fear, the erected pili muscle will contract, causes your hair stand erect and raises the skin, causing goosebumps and aids in regulating body temperature.
As precious as our hair, nerves are also exist where it's formed as layers of keratin and appear at the dorsal tip of the fingers and toes. It grows begin at the nail matrix that create new cells and pushes old cells out distally. Have you ever wondered how sebum and sweat secrete from? Sweat gland, or we call it as sudoriferous glands, are divided into two acrine and apocrine glands. Okay, last but not least, sebaceous glands are part of pilosebaceous unit, including the hair follicle and erector pili muscle. It secretes an oily substances called sebum. This layer adds a mixture of lipid that forms a thin film on the skin.
As Dr. Sabrina mentioned earlier, sweat gland divided into two, which are acrine and apocrine glands. Acrine gland produce serous liquid to regulate body temperature, while apocrine glands produce milky protein, rich sweat, which is present in axilla and pubic area. These glands are responsible for odor as bacteria break down the secreted organic substances. We always complain that our skin becomes so oily, especially during hot day, right? Actually, this oil is secreted by sebum gland, which is important to our skin. This layer adds a protective layer, prevents fluid loss, and also plays an antimicrobial role that can prevent from infection. It also prevents drying and cracking on skin, especially during the exposure of sunlight.
Like any other system, the integumentary system also works together with the nervous system to perform some of its basic functions. If we could recall that within the dermis layer of the skin, there are several receptors such as the thermoreceptor and the sensory nerves that can be found, which are linked directly to the central nervous system. Sensory nerves, such as the mucinous corpuscles, the Pacinian corpuscles, and the rufinous corpuscles, that are located near the base of the epidermis for greater sensory over contact within the surface of the skin. Since the skin is the outer covering, it is closest to the external surrounding, where external stimuli can be detected quickly. Thus, an immediate signal can be sent to the central nervous system to initiate homeostasis in conditions where external temperature can cause a change in body temperature, and where sensations over the external surface of the skin can be detected to trigger a reflex movement and allow better grip over the surface of the object. For sensory perception, however, we have specific nerves that I've aforementioned, the group of sensory nerves that are the mucinous corpuscles, the Pacinian corpuscles, and the rufinous corpuscles. For light touch, such as a cotton wool, where they are the most sensitive nerve would be simulated among the three that it would be simulated, that is, the mucinous corpuscles. Thus, they can detect the slightest touch as they are easily simulated. So when we are holding something that is light, like a cotton wool, the first nerve to be simulated will be the mucinous corpuscles, and upon sensing the wool on the surface of the skin, the central nervous system will receive the nerve impulse from the mucinous corpuscles, and a light grip will be formed as it has a firm grip on the object. We also have the Pacinian corpuscles. Now, this mechanoreceptor can detect the change in pressure and vibrations on the surface of the skin. So as to say, when we are changing grips on the object, such as a pencil, if say you have a light grip on this pencil and you adjust the grip and pressure you apply on the pencil, this Pacinian corpuscles is what detects the change in pressure applied to the pencil. And lastly, the final mechanoreceptor would be the rufinous corpuscles. This mechanoreceptor is located in the deeper layer of the dermis, and they are more sensitive to stretch or pain. In other words, they detect injury. For example, during a thumb prick, a sharp end of the prick penetrates the epidermis and enters the dermis. This would stimulate the rufinous corpuscles to transmit signals to the central nervous system. Pain would be felt in the finger to remove it from the prick.
Now, allow me to demonstrate how thermoreceptors that are located near the skin surface can detect the change in temperature of the external environment. In conditions where the external environment shows that temperature is hotter compared to the body temperature, the body will absorb more heat from the surrounding that will cause the body temperature to be raised above normal level. To prevent this, the thermoreceptors that are located in the skin detect the change in surrounding temperature and signal the hypothalamus, which then relays the signal to its corresponding effectors, such as the sweat gland, blood vessels. The sweat gland, upon receiving the signal from the hypothalamus, will secrete sweat on the skin surface that will absorb excess from the body to evaporate. Thus, the body temperature will drop and return to normal level.
However, at cold temperature, the amount of heat in surrounding is lower than our body. If this prolonged, our body temperature will drop as our body heat will be continually lost to the surrounding. To prevent this, the thermoreceptor in the skin will detect the drop in temperature of external environment and transmit signal to the hypothalamus, which in return will relay signal to the skeletal muscle, smooth muscle, surrounding blood vessel and the irritable pili muscle. Skeletal muscle will stimulate to move to generate heat, while smooth muscle surrounding blood vessel will contract.
Do you guys know that nail fungus is a common condition that starts with a white or yellow spot under the tip of your fingernail and toe? Onychomycosis is another term for nail fungus. Athlete's foot occurs when fungus infects the areas between your toes and the skin of your feet. Nail fungus may cause your nail to discolor, thicken and crumble at the edge of the fungal infection progresses. It can affect multiple nails. Various fungal organisms cause fungal nail infections. The most common cause is a fungus known as dermatophyte. Mold and yeast can also cause nail infections. Fungal nail infection can strike anyone at any age, but it is more common in the elderly. As the nail ages, it can become brittle and dry. As a result, fungi can enter through the cracks in the nails. Other factors such as decreased blood flow in the feet and a weakened immune system could also be involved. Severe case of nail fungus can be painful and permanently damage your nails. If your immune system is suppressed as a result of medication, diabetes or other conditions, it can lead to other serious infections that spread beyond your feet.
Albinism. Dr. Alip, do you know what albinism is?
I heard of albinism. It is an inherited disease.
Yes.
But I think you should explain more to the audience.
Alright, sure. Albinism is an inherited disorder where there is little or no production of pigment melanin. It is caused by a mutation in one of these genes. If you guys want to know, different type of albinism can occur based on which gene mutation caused the disorder. The most recognizable symptom is their white hair and very light color pigmentation of skin. I'm not sure if everyone is already aware, but albino skin is very sensitive to light and sun exposure. Even the slightest sunburn can increase the risk of developing skin cancer. Another major symptom of albinism that people could straight away spot is by looking at them is the lack of pigment in the color of their irises, and cause irises can completely block light from entering the eye. That's why very light color eyes may appear red in some lighting. There are multiple ways for us to diagnose this syndrome, like including physical exam that check the skin and hair pigmentation. Usually, doctors will do a thorough eye exam and compare the patient pigmentation to other family members. Because albinism is a genetic disorder, it can be cured. So their treatment is just only focuses on getting proper eye care and monitoring skin for signs of abnormalities and aggressive skin cancer called melanoma that can appear as pink skin lesions. Thank you. That's all from us.
Datin Alia, Do you think research is important?
Yes, of course.
Absolutely. Nowadays, a lot of study have been done by specialists and researchers in order to convert our technology to the sake of humanity. In addition, our topic today, the INTEGUMENTARY system, has gained new knowledge. Based on the study that I did, the latest research on 14 June 2017 by Hope K and Guol L, where to treat fungal nail infection from inside the body, you can take the tablet that inhibit the growth of fungi or kill them. They are all only available with prescription. Terbinafine and itraconazole are commonly used for this purpose. This oral antifungal agent also help a new nail to grow free of infection, slowly replacing the infected part. Lastly, this oral antifungal is the best option because it clears the infection faster.
Next, based on the reading that I had made, the latest research in 2018 by Nur Hamida and Evi Arbianti shows that topical therapies such as medicated nail polish and nail cream can be used to treat nail fungal. Some topical therapies used are potassium permanganate, amorolfine nail lacquer, cyclophosphoramine, and more. This medicated nail polish contains the growth-inhibiting and antifungal ingredients such as amorolfine or cyclopyrox. Amorolfine is available in the form of 5% nail polish and applied to affected nails 1 or 2 times a week for 6 to 12 months after removing as many infected areas as possible from the nail plate. With both treatments, the old layer of polish has to be removed using an alcohol swab before applying the new layer. However, now they produce more water-soluble cyclopyrox nail polish to it, so it is easier to remove before applying the new layer. Studies has directly compared the effectiveness of amorolfine and cyclopyrox, but clinical improvement shows that cyclopyrox is usually lower. While for medicated nail cream is also one of the topical treatments, in 31st March 2020, a research published by Derek K. Mercer and Jennifer Robertson shows that novostatin is an antifungal peptide specifically designed for the topical treatment of onychomycosis. Novostatin is a water-soluble cyclic fungi peptide that effectively penetrates human nail. They tested on patients and the result shows no fungi detectable by culture of fragments from novostatin after 180 days in the first study. Likewise, 56.5% of patients were culture negative for dermatophytes after 360 days in the second phase study. In both trials, novostatin was applied daily for only 28 days in March. Patients reported positive results with participants recording an improved appearance of their nails after only 14 days of application, contrast to other topical treatment for onychomycosis that require application for up to 52 weeks. These two pictures shows patient nail before treatment for 28 days and after 180 days. The nail was treated daily for 28 days with novostatin solution.
Now, to recap our math talk, we've talked about the integumentary system, its components such as the skin, along with its appendages, how it normally functions, such as secretion of sweat and sebum, also shedding of skin to prevent bacterial growth. We also talked about how it worked alongside the nervous system in thermoregulation and sensory perception. We also touched on some diseases that are associated with this system. That can be albinism, that is a genetic disorder characterized by a light-colored skin and white hair. We also have onychomycosis, also known as nail fungus, that affects the nail. We also brought up a current research that studies on a method to treat onychomyosis with oral medications, a special cream to be applied on the infected nail, also a medicated nail polish, which have been proven to be effective against nail fungal. That would be all from us, Group 5. Signing off. Bye!